This presentation must be supported with your organization's policy and procedure, as well as your provincial legislated requirements. Today, you will learn the key terms used in caring for persons with dementia and responsive behaviors. We will briefly discuss the impact of responsive behaviors and how a person-centered care plan approach will improve quality of life for the person and those who care for them. We will discuss the requirement that care planning involves assessment and monitoring on a scheduled basis and with change of condition. Briefly, we will review the goals of minimal medications and reducing the use of antipsychotics. We will end with an overview of tools and resources for care providers, as this presentation will provide a broad picture of this topic. Situation-specific information and more detailed explanation are available through a multitude of resources. We will discuss this upon the completion of the presentation. Caring for individuals with cognitive impairment and the associated responses requires a multi-level approach involving different individuals, areas of expertise, and with the use of the resources and guidelines found in legislation and organizations who research and provide best practices. Your role as a care provider is to work with your team in using all of these resources and continue with ongoing education made available through organizations such as the Alzheimer's Society. The Alzheimer's Organization defines dementia as an overall term that describes a group of symptoms associated with a decline in memory or other thinking skills severe enough to reduce a person's ability to perform everyday activities. Alzheimer's disease is a type of dementia, and it accounts for 60 to 80% of cases. Vascular dementia, which occurs after a stroke, is the second most common dementia type. There are other types of dementias, including frontotemporal lobe and Lewy body. Dementia signs and symptoms vary based on the type of dementia and an individual experience, where not everyone will be the same. Caregivers will notice changes in memory, the ability to communicate, focus, and follow through. Reasoning and judgment are affected. The person will experience challenges in planning. A spouse may notice that her husband, once an excellent cook, is no longer able to prepare a meal properly. Some caregivers become concerned because their loved one starts to get lost when traveling a short distance from home. Many dementias are progressive, meaning symptoms start out slowly and gradually get worse. Early diagnosis allows a person to get the maximum benefit from available treatments. Individuals experiencing changes in their cognition show a change in behavior. This change in cognition may be from one of the dementias, a mental illness, substance abuse, or other neurological disorders such as brain injuries. These behaviors may be problematic, especially if they cause harm to the person or others. Perhaps you feel that the responsive behavior is of no consequence to the person, such as rummaging. However, this behavior may be highly disturbing to those living in the same area, causing their own responsive behavior. You may observe this when the rummaging is in the room of another person. In addition, the caregiver may observe hitting, biting, spitting, destroying property, sexually inappropriate behavior, pacing, and trying to get somewhere, eating inappropriate substances such as soap, hoarding, repetitive manners or sounds, general restlessness, and vocalizations such as screaming and cursing. The behaviors are often in response to something. Caregivers have a huge role to play in trying to determine what that something is. Consider three main areas. 1. Unmet needs. 2. Stimulus. 3. Response to approach. For unmet needs, we look at physical needs such as food, water, toileting, and pain. Social needs, such as being involved in a purposeful activity with others, and psychological, including feeling lonely and needing some personal touch. Stimulus in the environment is often secondary to noise. You may observe that some persons become quite upset by loud music, shouting of others, and the fire alarm. We also know that caregiver approach is key in minimizing responsive behaviors. This includes providing care at a certain time of day, the caregiver's tone of voice, and the sense of rushing and expressing frustration. Have you ever tried to get your sleepy family to hurry up in the morning and get out the door in time? The more you try to rush, the more they slow down. For the persons we care for, a simple change in time may do the trick. Once a person responds to these situations and it is not managed, there is often a downward spiral. The person is distressed. Others around them become disturbed. Staff may need to intervene in redirecting. They begin to feel rushed and frustrated. This results in an increase in responsible behaviors, and now we have a recipe for disaster with the potential for violence. The staff will notice a change in behavior of the person that they are caring for, such as an increase in fear, anxiety, and restlessness. The person is resistive to normally accepted care activities such as redirection or offers of food and rest. The person becomes argumentative and verbally aggressive with yelling and swearing. This will often escalate to physical aggression such as hitting the care provider. The key here is to de-escalate before the situation moves to aggression. Staff know the person the best and may begin to observe small and subtle changes in behavior that should not be ignored. Use a calm voice and attempt to redirect. Consider the trigger and address that, such as remove from a noisy environment, or meet a need for comfort or food, for example. Should the individual escalate to physical aggression, remove others who are at risk and observe from a safe distance. The individual may wear themselves out and will need your comfort and support, or the situation may pose imminent risk. If so, you must activate the response system set out in your policy, which may include medication, restraint, or calling the police as a last resort. It is important to understand that a de-escalation approach involves early detection and intervention, non-pharmacological strategies to be used first, and medication and restraints as a last resort. There are many education resources for crisis management, and you are encouraged to supplement your education with these programs. Preet is becoming anxious and resistive to sitting in the dining room for breakfast. How do you think you could provide care that would minimize the person's feelings of distress? Try this knowledge check. Check as many items as you think apply, then click Submit. Correct. All of the answers are correct. There are many experts in the field of dementia and responsible behaviors that have excellent task-specific strategies for caring for persons with dementia. At the core of these strategies, and in all that we do, we must focus on personhood. Know the person that you care for. What was their life like before you met them? Introduce things that are familiar. They may not understand words, but they do respond to someone who feels empathy and compassion. The person will come to trust you if they feel these characteristics. Demonstrate these core values in how you communicate. Billy is a kind and great healthcare provider. He gently takes Gord by the hand to walk towards the bathtub. Gord pulls his hand away and smacks Billy. The next day, David gives Gord his iPod and plays his favorite music. David comes back several minutes later with towels and soap. He shows them to Gord and gestures washing his face. Gord happily walks to the tub with David. David's approach included knowing Gord and that Gord is quite calm when listening to music, using body language and cueing with towels to set up the bath time. This is an example of an individualized care plan with a focus on personhood. The care plan for Gord and others like him involves an initial assessment and plan with ongoing monitoring. The whole team engages in this. An activation department employee notes that Gord likes jazz. A dietary aide notes that when she shows drinking from a cup, Gord picks up his coffee and begins to drink. The environmental team staff know that when they turn on cleaning equipment that is noisy, Gord gets upset. They plan their cleaning of his room when he is in art class. Gord will change over time. The care plan is never static. It will be reviewed and revised on schedule and as Gord's situation changes. Sometimes we see older adults who are taking 10 or more medications called polypharmacy. These medications may be needed and working, or they may need to be reviewed and reduced or eliminated. This is because of interactions between medications that may cause adverse side effects. Also, older adults do not metabolize and detox medication effectively. We also need to consider that although these medications may have been needed many years ago, it is possible to stop them now. Some of these medications, such as antipsychotics, may have been prescribed to manage responsive behaviors. However, we are learning that the effects of medications may in fact worsen symptoms and lead to other unwanted effects, such as falls. Rather than use medication as the first option to manage responsive behaviors, non-pharmacological interventions should be used. These include those strategies that focus on personhood. For example, a person who is resistive to bathing in a tub in the morning may respond better to a shower in the late afternoon, just like they used to do when coming home from work. Routine medication use to manage behaviors without a definitive diagnosis exposes the person to possible negative effects, such as those associated with sedative effects, including lowered blood pressure, thrombus or clot formation, falls, and aspiration. Also, these medications may not be effective in managing the behavior. With an assessment and diagnosis of such things as depression, anxiety, and psychosis, an individual will likely benefit from safely introduced medication. Medications are also required on those occasions where there is an imminent and significant risk of harm. PIECES is a trademarked education program. It is a holistic, person and care partner-directed model which enhances capacity at the individual, the team, organization, and system to support the care of persons living with chronic disease and/or cognitive and mental health disorders. PIECES provides a practical framework for assessment and supportive care strategies using a person-directed approach. This framework supports care across the system with a focus on health promotion, prevention, and chronic disease management. It encourages the whole team to consider multiple underlying causes of behavioral expression and areas of need. Strategies build on the person's remaining strengths and considering the person's physical, intellectual, and emotional health. Supportive strategies to maximize capabilities, the individual's social and physical environment, and his or her social self, for example, cultural, spiritual, and life story. There are a number of tools to assist you in determining the needs of the person that you care for, including a behavior tracking tool. This tool will prompt care providers to describe what was happening when the responsive behavior was exhibited, then what happened when you intervened. Then you will have enough information to develop a care plan for the individual. Here is an example. After using a behavior tracking tool for 2 weeks, it became clear that Gord showed distress secondary to the noise of the dining room at the evening meal. The solution was to seat Gord with other table mates in an adjoining space that was quiet and supported by the activation team. The interdisciplinary team added this information to the care plan. Strategies for caring for persons with dementia and responsive behaviors is a vast area of expertise. There is a significant amount of information available to you. The Surge Library has several modules. The Seniors Health Knowledge Network and Brain Exchange has online resources, and local community colleges offer courses. Education, along with support, will come from your local Alzheimer's Society and your tertiary care centers and outreach teams. Tertiary centers offer comprehensive assessments off-site at a specialized care unit. They also provide outreach teams to teach and work with your team on-site in the assessment and development of a person-centered care plan. We encourage you to link with your supervisor or staff educator to assist you in your ongoing education. Today you learned some key terms and the impact of responsive behaviors. We discussed using individualized person-centered care planning that included the reduction in the use of medication and antipsychotic medication. We provided a brief overview of resources for your ongoing education. Thank you for joining us today for our module on dementia and responsive behaviors, brought to you by Surge Learning.